Okay, good afternoon, everybody. Today we are continuing our product topic, the use of basic and target Lingzhi. I think some more company have putting more focus for us to use target Lingzhi, as target Lingzhi has more research based and more efficacy, and we even have a lot of patterns on the certain Lingzhi and the health function, for example, the kidney and also the cancer disease. And we still have our traditional basic Lingzhi, which is our Yongkian Lingzhi, Yongkian 2, and Jiahou Lingzhi. So today's topic will be focused on how to use of the basic Lingzhi and the target Lingzhi together for various type of health condition. I understand that some leaders might have a confusion. Since we launched the target Lingzhi, they don't know what to offer to the customer. And especially we have mixture of the basic and the target Lingzhi. So today's topic basically to tell everybody, provide you a guideline on how you propose a dosage to various health conditions like for health maintenance purpose, pre-illness purpose, or even illness conditions. Okay, so let us start. Before I start, let me go through a disclaimer. All the information contained in the slide are intended for general health information and educational purposes only, and are not intended to be used as a substitute for a professional medical advice, treatment, or care. Okay, let's start with our base Lingzhi. As I mentioned, our base Lingzhi consists of Yongkian Ganoderma, Yongkian Ganoderma 2, and we know that company is phasing out our Yongkian Ganoderma 2 very soon, as now we have more target Lingzhi. So before I talk about target Lingzhi, so I'll talk about Yongkian Ganoderma. So for Yongkian Ganoderma, we are actually having this 2000 awarded Taiwan first immune regulation health food accreditation, followed by 2001 we awarded the Taiwan very first liver protection under the health food accreditation. So for immune regulation, I think a lot of people have seen this. We've been awarded with 5 functions: promote the production of antibody, production of immune cell, regulate the function of T cell, promote vitality of natural killer cell, and promote vitality of phagocyte. Under liver protection, help reduce the indices of GOT and GPT, help increase the protein content of the liver. So Yongkian Ganoderma, I always summarize into 4 functions. Number 1, regulate immune system. The immune system is too low, you get sick easily. Your immune system is too high, you might have allergy condition, even autoimmune. I think that's how we mentioned about by Jim. We have this thyroid disorder. Graves' disease is usually autoimmune disease. Yongkian Ganoderma also very good for liver, enhanced liver function, liver protection, and it's good for improved blood circulation and remove free radical and anti-oxidation. I think this one we are very familiar with it. So for health maintenance, we will talk about 4 to 8 capsules daily, depending on body weight. People have pre-illness, for example, 3 high, it's good to take about 12 capsules daily. For illnesses, for example, people already give a name. For example, kidney deficiency, kidney disease, or anything. Last time we normally propose to take about more than 20 capsules daily. Or for cancer patients, we are proposing to take about 30 to 60 capsules a day, even 120. But with the Yongkian 2, with the current target Lingzhi, now we're doing to use this Yongkian Ganoderma. But Yongkian Ganoderma is still used as a base for many people to consume. So it's still good. Base means that it can consume by everybody. Okay. So now I move on to even target Lingzhi, Yongkian I. Yongkian I Ganoderma, today I only want to do a summary, but we have covered this in many sessions in detail on specific equivalent target Lingzhi. Yongkian I Ganoderma I think we know that it's actually for immunomonitory, for example, antivirus and anti-allergy. And now, like for example, now there's a flu season going on year end, so I'm actually very encouraging all my customers to take Yongkian I. Yongkian I is actually is a base. The base is actually Yongkian Ganoderma, so you have a very good liver protection property, and because of the added uh, beta glucan 1,3 and 1,6, it has very good property on anti-diabetic. So I think this one we know about it. So for health maintenance purpose, or we relieving slightly illness, we take about 2 to 3 sachets daily before meal. And for example, for certain emergency situation, like for example, when you get COVID-19 virus, you get a very serious flu virus, or you're attacked by virus or any kind of virus, you can take 1 sachet every 2 to 4 hours, even taking to 6 or 8 sachets a day. So this for Yongkian I. Okay, we move on to Yongkian B. I think Yongkian B stands for bone. So Yongkian B have a high concentration of 1,3,1,6 beta glucan, which is belong to the macromolecular polysaccharide group. And actually it's a stem cell. I will call it as it's the stem cell Ganoderma. Stem cell, you know what's the meaning of stem cell, right? Stem cell is the one we convert to any our body cell. It's just like when playing cards, there's a card called Joker. This Joker actually can substitute any card you like. So this stem cell got two types of stem cell. One is a hematopoietic stem cell. One is called the mesenchymal stem cell, which is called peripheral stem cell. So the bone marrow stem cell, we call it, actually can build your blood cell, for example, red blood cell, white blood cell, and the platelet, because bone marrow is the one who produce all the blood components. So this product is very good to target for people going through chemotherapy, any targeted therapy, and other medical use that actually suppress the bone marrow from producing all the blood components, white blood cell, red blood cell, and platelet. And this product also have the mesenchymal stem cells, which is actually very good for grow, repair or regrow your other part of body organ. So you're repairing damaged tissue, organ, and severe infection that caused by severe infection or aging. For example, when people are taking antibiotic, going through trauma or surgery, going through radiation therapy, or sometimes even some so-called accident injury. So this is also a very good product. So recommended dose is about 1 to 2 sachets daily. And for emergency situation, you can take out of 4 to 6 sachets daily. For example, people having trauma accident, or they're having, for example, a massive virus or bacterial attack in the body. So you want to quickly build the immune system back. Then you can give more of this Yongkian B. Okay, we move on to Yongkian K and S. Yongkian K and S, I think we know is for our kidney protection and kidney repair. If you're wondering what's the two difference between this product, one sachet of Yongkian K is equal to 6 tablets of Yongkian S. I repeat, one sachet of Yongkian K is equal to 6 tablets of Yongkian S. So kidney is our detox organ in the body. It actually filter all the waste from the blood into urine, and then after that release to bladder and our urinary tract system. So it's good to, if your body have a better strong kidney, you can better effectively remove waste, remove toxin. And some people have this toxin because of medication. You need to release from the kidney, and this is a good product to follow. Kidney disease, when people are having kidney deficiency, this is a product to take. According to Dr. Chen Tenhai, if the kidney function, we call EGFR, is less than 50. Okay, normal people EGFR have to be more than 90%. And when the EGFR is less than 50, and if it goes to 15 to 30, you might need to go for kidney dialysis. With kidney EGFR less than 50, you can take Yongkien K. But it's between 50 and 90, you can still take Yongkien S. So Yongkien K definitely is a more concentrated product for this kidney protection. And you also protect heart, liver, and lung and brain. Okay, and for people who have serious allergy problem, autoimmune diseases, this is also a product to offer. So to stay healthy, 1 to 2 tablets of Yongkien S per day. For example, you want to do a cleansing on your kidney. For this minor physical issue, you can take out to 4 to 6 tablets of Yongkien S. People who go for dialysis, you can, or as I mentioned, already close to dialysis situation, you can take 2 sachets of Yongkien K or 12 tablets of Yongkien S. And all this effectiveness I mentioned about is actually proven by animal experiment in our lab certified by GLP, which stands for Good Lab Practices. Any product that need to send for example, American FDA approval, you definitely have to go through an animal study first. An animal study must do in the lab that have this so-called GLP accreditation. I might find a chance to talk about what is GLP in detail next time on how we use this lab to certify the efficacy of product. And I mentioned just now, our product got many patents in the world. What's the meaning of patents? It means that we are the first one in the world to come out with this kind of product for certain condition. Like for example, our Yongkien K and Yongkien S had a patent on kidney function improvement, and we got patent from China, Taiwan, EU, USA, Hong Kong, and Singapore. And this is very encouraging, and it means that for many years, we are the only one who can come up with product that actually to address kidney problem, and that's why I got this patent. Okay, let me move on to Yongkien C Ganoderma. This is the most valuable product in our equivalent target Lingzhi range, which is for cancer. So you have high concentration and a high purity of ganoderic acid TS and dosideric ganoderic acid S, and it's very good to fight cancer cell. Okay, and this product actually able to pass through our BBB, brain-blood barrier. This BBB is a filter that actually preventing all the bacteria viruses to go up to the brain, because brain is a very crucial organ in our body because it's the central nervous system. And so because it can pass through BBB, so it can help to support sleep, stabilize our nervous, and also brain-related function. So this one is actually can provide aid to our neurological function. So and for cancer, for people who suffer from cancer, so we can propose to take 4 tablets per day. People with trouble of sleeping can take 1 or 2 tablets per day, and people who have actually, for example, Alzheimer's, okay, and all these kind of diseases, okay, dementia disease and all this, so this one can actually also take this product 1 to 2 tablets a day. So Yongkien C also have patent. It's a patent on therapeutic composition for treating cancer. And as I mentioned, we are the number 1. We obtained patent from numerous countries: US, Taiwan, Singapore, China, Hong Kong, and even Macau. So basically, we're talking about worldwide patent. So this one is very, I would say, is very encouraging. We are the number 1 in the world to able to secure the patent using Ganoderma for cancer treatment, which is not easy. So how to choose appropriately? Our basic Lingzhi, Yongkien 1, or Yongkien 2 is facing out, okay? So Yongkien 1 you choose for maintenance health, okay? So you still can use to achieve certain therapeutic effect, but you need to take high dose. But now with the equivalent target Lingzhi, you're aiming at specific disease to combat them effectively. So actually you can take fewer dose to achieve desired effect in a shorter time span. So this one is actually the way you use basic Lingzhi and equivalent target Lingzhi. Okay, uh, so I repeat, basic Lingzhi for health maintenance. To elevate symptom of illness, you can slowly move on to equivalent target Lingzhi. You aim at specific disease to combat them, for example, kidney problem and cancer, you can straight away use equivalent target Lingzhi. Okay, let me share with you some guidelines we use. For example, for health maintenance purpose, this is just a guideline, okay? So anyway, Lingzhi have the no limitation on dose because we do have side effect. Lingzhi do have side effect. We're taking even a higher dose, so it's very safe to recommend any dose to people. So for health maintenance, so maintain of the body physical function, you can use Kien Ganoderma 4 to 6 caps daily. We will talk about this. Just the health maintenance 4 to 6. Okay. People say, can we use Kien I instead of Kien Lingzhi? Yes. You can use 1 to 3 sachets daily. Especially if the family member having history of high blood glucose or diabetic. You know that Kien I product beside designed for antivirus and bacteria, you also design for combat high blood sugar or diabetic. So people who have just had high blood sugar or diabetic, he can take just Kien I. Okay, so for health maintenance purpose, you can take 4 to 8 capsules daily for Kien Lingzhi, Kien Ganoderma, or you can take 1 to 3 sachets of Kien I. So for high people who suffer more history, the family history, he might don't have yet, but he have family suffer from high blood sugar or diabetic. You know that if both parents having diabetic, the chance of the next generation having diabetes is 50%. Okay, for people who need intense health maintenance, for example, when you are more than age of 40 years old, you need to have more repair and maintain body physical function. So you can take Kien Lingzhi or Kien I, but you can plus Kien B Ganoderma. Remember, Kien B is actually a stem cell product for bone marrow stem cell and your other body organ stem cell. So you can take together. This one is to maintain body physical function. You can still take 4 to 8 daily of your Kien Lingzhi or 1 to 3 sachets Kien I, but you can added another 1 to 2 sachets of Kien B to help to repair the organ. So you can see the base is still your Kien Ganoderma and Kien I, but you plus the Kien B 1 to 2 sachets a day, especially people who need to do repair and more maintenance of body function, especially they are more than age of 40, where the organs slowly already in the degenerative stage. However, when people who suffer from certain autoimmune disease or they need more repairing, they can do Kien or Kien I plus Kien B plus Kien S Ganoderma. Okay, so it's the same formula, but you can add on another 1 to 4 tablet of Kien S. It means that after age of 40, if you do a EGFR test on your kidney, you know that it's still about, maybe it's already less than 90 already, or range of 87 to 90. Maybe it's good that you add on a Kien S 1 to 4 tablet a day. Or the person having some autoimmune diseases, as mentioned by Jim, for example, the grave diseases that will affect thyroid, he can add on Kien S. So I repeat, your intense health maintenance, beside the Kien Ganoderma, Kien I Ganoderma, you can plus Kien B. People who want to have more kidney protection and also maybe have autoimmune disease, you can add on Kien S. So this for health maintenance, okay? How about pre-illness stage? For example, people who have 3 high, okay? We always say, if last time we already talked about, if you are using Kien Ganoderma, you can take about 12 cap daily and above. However, you want to use Kien I, that's also possible. Then you must use 4 sachets of Kien I daily and above. This is particularly important if the person having a diabetic or the family member having diabetic. Okay, 3 high, that is diabetic, so we can use this. And because for example, tree high, the kidney already suffer the deficiency already, or because the long-term use of tree high medicine, which might be burden the kidney and liver, so it might add on another 4 to 6 tablet of Yongan S or another 1 sachet of Yongan K. I repeat, for pre-illness at tree high stage, you can use Yongan Ganoderma, you can use Yongan I if the person having diabetic. You can add on Yongan K or Yongan S if the person actually have long-term use of vitamin medication or there's a kidney deficiency. Pre-illness also apply there's some autoimmune diseases. Okay, then you can use Yongan B 1 to 2 sachet daily. And if the autoimmune disease is more serious, so called severe autoimmune disease, and there's a kidney damage, we strongly recommend to add on 4 to 6 tablets of Yongan S and another 1 sachet of Yongan K daily. So for autoimmune disease, you will give Yongan B, but if it's too severe autoimmune disease and also affect kidney, we recommend to add on Yongan S and Yongan K. Okay, how about illness stage? For example, kidney dialysis. People already start kidney dialysis or the eGFR rate at the range of 15 to 30. You need to go for kidney dialysis very soon. Then in this case, we recommend 12 tablets of Yongan S or 2 sachets of Yongan K. So this is for kidney. Now the problem of people who are going through kidney dialysis. When people go through kidney dialysis, does it need to take Yongan K? The answer is yes, because they actually help further to stabilize the body, especially when you go through kidney dialysis. However, you want it to recover from your kidney from dialysis. If the person just started dialysis for 3 months and 6 months, maybe still possible, there's a chance. But if the person dialysis for more than a year or 2 years, the kidney already shrink, they might have no chance to recover the kidney function. Cancer, is recommend Yongan. We strongly recommend Yongan B to start with, 2 to 4 sachets daily to wake up immune system to better detect, to let immune system detect which one is the cancer cell. So Yongan B actually recommended 2 to 4 sachets daily plus Yongan C Ganoderma tablets, 4 tablets daily, especially if the 3 and 4, stage 4. Stage 1 and 2, you still can consider take about 2 sachets of Yongan C. However, if the kidney function already affected, partly because of the treatment or the cancer drug, we recommend another 4 to 6 tablets of Yongan S daily plus another 1 sachet of Yongan K. So for illness stage, if it's kidney, add on Yongan K and Yongan S. For cancer, we use Yongan B plus Yongan C, and the kidney affected, we put on Yongan K and Yongan S. So conclusion, the principle of taking Lingzhi to achieve optimal benefit, you take in a fixed time, fixed dose, duration, daily, and minimum you take a duration of 4 to 6 months, because your bone marrow will need about, for example, 4 months to build a new batch of red blood cell, for example. So you generally need to take consistently every day at a fixed time and fixed dose. So this is for a person to achieve optimal result from taking Lingzhi. Okay, and that's all for my presentation. Thank you.